All right, guys, this is Dr. Danesh. I'm going to talk today about coronavirus and everything that I've learned in the past few weeks. As you can see, I am at my aunt's house. We just had a dinner event. You can see everybody is nicely socially distanced from each other. Everybody has that 6-foot barrier. We just had an amazing meal cooked by my aunt and uncle right here. And I just wanted to take a little bit of time. So as some of you may know, my background is in anesthesiology, and I've got a lot of friends who have been who've been dealing with coronavirus, be it intensivists, be it emergency docs, both in the US and abroad, folks at Johns Hopkins, folks at University of Pennsylvania, people in New York dealing with the crisis as it's unfolding. And I wanted to take a little bit of time to consolidate everything that I've been able to accumulate, all the information I've been able to accumulate over the past few weeks, and try to distill it in a way that people can understand. Because I think there's a lot of misinformation, a lot of myths out there, and I'd like to clarify some of those things. It is a serious condition, it's a serious disease, but it's not as terrifying as it needs to be. And in fact, with just a little bit of understanding about what's going on, how the virus spreads, what the public health response is, I think it will help calm some of the fears and also help you feel empowered that we can actually do something about this and be in control of the situation. So I've put together a little bit of a little presentation, and we'll see how this works. I'm going to just present it off of my screen, but essentially I'm going to talk about coronavirus and give an update as to what I understand about it. So the question is what is coronavirus and how does it actually spread? Well, you got to understand what a virus is to begin with. A virus is just simply DNA that's wrapped up in a like a cellular capsule, and this DNA or RNA these are essentially codes that give biology its meaning. Like all of us are written, our DNA is determining how we grow, how we develop, what makes us prone to disease and other conditions. Viruses are essentially snippets of that DNA code or RNA code that are able to then travel throughout the body, attach to a cell, and then hijack that cell's internal organs to replicate and produce more virus and put it out into your body. What makes coronavirus so virulent is that it has a receptor that makes it much more accessible. It makes it easier to access the cells in your body. And so it has an easier way into cells than previous coronaviruses out there. As a result, it can get into our cells and very quickly take over. The way that our body reacts to it is by creating an immunologic reaction, which means our defense cells go into defense mode and start attacking the virus. But if the virus is really effective in penetrating our cells, then it can get in there and very quickly start to reproduce and overwhelm our own immune system. So, where it came from, we think, is actually this animal called a pangolin, because the pangolin is also a carrier of the coronavirus, this new strain of coronavirus. Interestingly enough, the pangolin is the only mammal that has scales. Fairly nice guy, but unfortunately, the virus was able to either utilize that mammal to mutate in a version that is more susceptible or more capable of attacking us. And so it spread from the Wuhan province, and because of its virulence, because of its ability to jump into new bodies and replicate and take over, it's been able to spread as quickly as it has been spreading. So In the U.S., you can see that there's virus pretty much everywhere in the U.S. Kentucky has been pretty effective. It's kind of an oasis in a sea of darker orange. We've been pretty good about containing the virus because of the very progressive and proactive decisions that our governor made. And I gotta give a lot of kudos to Governor Bashir and Dr. Stack and our local public health commissioner, Dr. Humbaugh. They have been phenomenal. I think the response from Kentucky is really stellar in comparison to the rest of the nation. We've done an amazing job of containing this virus, and I'll explain why in a little bit. But the short of it is that the virus is indeed everywhere, and it's in your community, but there's no reason to panic because it's easy to get scared of the virus and get terrified, knowing that, yes, it is present in the community. It is present probably in your neighborhood, but how is it going to affect you is the bigger question. And the virus itself is most transmissible through hand to oral transmission, meaning that we touch things, we touch objects, then we touch our face, and progressively as our hand is touching objects in the world, it's accumulating more and more virus on our hand, and then that hand touches our face, and progressively the more and more you touch it, the more and more virus accumulates around your face and can make its way into your nose, into your eyes, into your mouth. We think that the biggest form of transmission is around the nose. It gets in there, and if you only have a few viral products on your hand, or if you have a few viral products on your face, it may not even do anything to you. It may not have the critical mass needed to overwhelm your immune system and take over. But the more you touch it, the more you expose yourself to the virus, the more that virus can accumulate and get to a volume where it really is overwhelming to your immune system, and it takes over. Most people who are susceptible, pretty much everybody is susceptible, but people who tend to show the virus, who tend to show the symptoms of the infection, tend to be people who are older. So we've seen kids as young as 14-year-old get infected. We've seen younger kids even get infected, but they don't often show symptoms, meaning they don't get very sick, but they can be carriers and they can pass it on to other family members. So who's actually vulnerable to the coronavirus? Well, people who are over the age of 60, especially people over the age of 80, are really vulnerable to the virus because as we age, I mean, part of what we do in Wellward is we study aging. We study the impact of aging on how cells replicate and how they repair damage. While our focus is around pain, it's the same thing in the immune system. The immune cells are actually responding to the presence of the infection and reacting. But as we age, we have fewer immune cells, we have weaker immune cells, and particularly when we hit a certain age, our vulnerability to infection goes way, way up just because of the vulnerability of our immune system. So people who are over the age of 60, but particularly people who are over the age of 80, are really vulnerable to this. Anybody who has COPD or lung disease is really vulnerable. And I failed to mention earlier on what happens is that when the virus infects your body, your immune system reacts and tries to produce defenses against it, which if the virus has reached a critical mass, those defenses can actually become the bigger problem. And I'll get into that a little bit later. But anybody who has pre-existing lung disease or COPD, breathing problems, asthma, they are more vulnerable to the infection. People with heart disease, and it's more because your circulation is affected, and your ability to respond to an infection or overcome an infection is adversely affected. People with diabetes have a weaker immune system. Anybody who has an immunosuppression, like if you are taking medications to suppress your immunity, for instance, rheumatoid arthritis, irritable bowel, Crohn's disease, cancer. These are conditions in which medications that we prescribe are often reducing your ability to fight off an infection. And then finally, obesity. Obesity actually has a big impact because people who are obese have smaller lung capacity as a result of that obesity. They have more difficulty expanding their lungs. And so this is a breathing disease. This is a problem that affects your lungs. And if you're not able to overcome the impact of that disease, the obesity is definitely going to make it worse. So what can we do about it? Well, it's fairly simple. We got to just keep proper hygiene. I mean, we talk about hand washing and cleaning surfaces with infection. The good news is the virus is actually a fairly wimpy virus. I heard that from another doc talking online, and I really like that term, a wimpy virus. And it is, because all viruses have very little defenses against the outside world. That's why they need people, they need organisms, other organisms, to do the heavy lifting for them. They're very simple, and they have very few defenses. So simple washing is very effective. The CDC recommends just any most cleaning supplies will be effective, but even taking 5 tablespoons of bleach, putting it in a gallon of water, and using that to clean surfaces is effective. You don't have to get any hospital grade special anything. You don't have to go overboard, because again, the main route of transmission is a regular accumulation of viruses on your hands, and then exposing your hands to your face on a regular basis. There's not a lot of aerosolized contagiousness, the way that and aerosol means like particles in the air. The way that the virus can spread through the air is if you're in close proximity to somebody, you're having that close conversation. It's gross, but we all have little spitballs that come out, and those spitballs can accumulate on our face. They can accumulate, on our body, and then we touch and we kind of expose everything, expose that to our face, and then we create little farms of viruses on our face that then can become a node for getting into our body. So just simply cleaning surfaces on a regular basis, not going overboard. Don't get paranoid about things. If you touch an object, it's not like you're going to automatically pick up that virus. Or even if you do, as long as you wash your hands before you touch your face, you're gonna be in safe regards. So next question, how can I prevent from getting it? Well, that's a great segue from the last section of just keeping proper hand hygiene. But the CDC recommends hand washing more than anything. Soap and water is just as effective, if not more. No, well, I can't say that. But soap and water, hand sanitizer, these are effective things. I don't know which one is more effective, but they're both fairly accessible. And if we go into a shortage or a national shortage of hand sanitizer, nobody panic. We've got plenty of soap. As long as you keep your hands clean and wash them on a regular basis, your chances of transmitting them or infecting yourself become lower and lower. 30 seconds is the recommendation, and somebody came out with this Instagram posting of how long it takes to really clean your hands. Now, this isn't really reflective of the virus itself, but you can tell that just with the dirt and grime that's on a hand, after 20 seconds, we reach that point where it's reasonably clean. If you want to really go heavy duty, 30 seconds, but 20 seconds is the recommendation, and it's plenty. Other people have tried the same thing this is done just with a UV light, black light, so it's not really reflecting the virus, just kind of how much the soap has cleaned the skin. But somebody else did the same thing with hand sanitizer, and you can see that an unwashed hand is kind of gross. A hand sanitized hand is a lot cleaner. So again, it's good to do this on a regular basis, even if you're not necessarily around people who have the infection. You don't know that because anybody could be a carrier without you really knowing. Most people are contagious a couple of days before they show symptoms, but not everybody. So just make the assumption that everybody is vulnerable. Should you go out and run and get a mask? Well, up until recently, the recommendation was no. Just recently, they're wanting everybody to put on masks, and it's not necessarily because the masks are inherently protective. They are helpful in reducing somebody who has an infection from spreading it. But if you don't have an infection, there's a lot of gaps in the mask, especially people like me who have a beard, an unshaven beard effect. You can be, the mask doesn't do a lot to protect your inhalation. However, what the mask does do and what the recommendations are, oh, and by the way, you don't have to have an N95 mask. In fact, if you do, I would strongly encourage you to actually take that to a hospital and see if they can use it, because we really do need to protect our healthcare workers who are in the thick and thin of this. The highest rate of transmission is to healthcare workers, and the rates are as high as 30%. So if you can donate masks, if you've been hoarding them, please do donate them to a local hospital. They really do need them. For the rest of us, recommendation of a bandana, it sounds ridiculous because a bandana has never been shown to stop an infection, but what it's actually doing, what you're really doing with the bandana is you're reminding yourself to not touch your face. It's just a reminder to avoid touching things. Putting on a pair of gloves can do the same thing, because, you know, if you've got plastic gloves, you're going to think twice before you put it into your eye. Again, it's that hand-to-face transmission that we really want to be cautious about. So what do you do if you actually get sick? Do you need to go to the hospital? Do you need to run to the ER? And the answer is absolutely not. The ER is going to be so overwhelmed with infections that the recommendation is, unless you're in real dire straits, and I'll talk about that in a second, to just stay at home. Treat it like you would just any other kind of infection. You're gonna feel tired. You're gonna feel your body is gonna ache. Just take it easy. Go to bed. Rest. A lot of fluids. Tylenol is better than ibuprofen. But just wait it out, and it does get better for the majority of us. 80% of us or more. It's a typical infection, just maybe more or less extreme than what you've had before. In Japan, about 30% of people that carried the virus weren't even symptomatic. So we know that there are some people that don't get sick. It's just that the ones that do and are vulnerable to getting sick gets really, really sick. So it's mostly to help protect other people that we don't want to spread the virus, because it is so quick to spread. But if you are at home and you're resting and it's not getting better and you're starting to get worse and you're really feeling like you're having trouble breathing, or in this case, the guy is breathing fire, that would be a reason to go to the hospital and get some medical attention. Only about 10% of people who get infected get bad enough to really go to the hospital and be admitted. Most people are sent home to just monitor the infection at home. It's just that when people have breathing problems, things can decline very quickly, because what's happening in your body is the virus is spreading to cells in your body, taking over, and your immune system is what's creating the symptoms of being sick. So the body aches, the difficulty breathing, these are all reactions of your immune system. And if you have a very robust immune system, or your body is not keeping up with the infection, then things can decline very quickly. And a certain percentage of people that are hospitalized will need to go to the intensive care unit or have to have a respirator or breathing supplementation. Those are the ones we really have to take care of, because they're the ones that are most vulnerable to getting sick. But otherwise, the rest of us, just simply stay at home and take care of it the way you would every other infection. With your family members, try to create distance, create a boundary so that you're not infecting each other. The most infections happen among the household members. About every individual seems to infect between 2 to 3 people, and that's how the numbers can spread very quickly. So if you do have somebody at home who's sick, just simply keep them apart from everybody else, keep them separated in a different room. If you do have people who are vulnerable, like if you're living with a grandparent or somebody who has one of those health conditions like a breathing problem or a kidney problem, those individuals do warrant a little bit more safety. So if there's somewhere else they can go, definitely encourage them or help them to do that. But otherwise, as long as you maintain hand hygiene, keep your distance so that you're not constantly exposing aerosolized product. Not necessarily avoid that person. You don't have to like segregate them and not even go into that room. Just limit the exposure. If you do touch anything in that room, then go back out and wash your hands. Make sure that things are as clean as possible. One of the tricks that I said is, we all have a tendency of touching your face. I've simply been trying to be conscious of it myself, and I'm guilty of touching my face as bad as everybody else. I watch my family, and I've become kind of like the soup Nazi, where I say, no soup for you if you've been touching your face, and I call people out on it. And it's absolutely amazing how much you touch your face, how much, even when you're trying to be absolutely mindful of it, you touch your face. So think of it as you've been touching or you've been cutting up jalapeno peppers, and if you touch your face, you're not going to cut up some jalapenos and then go touch your eyes and touch your mouth. It hurts. And if you find yourself doing that a lot, hey, go buy some jalapeno peppers, touch it, rub it around your hands, and then see if you touch your face. And if you do, you'll know it. Believe me, you'll know it. So it's a little trick that may actually help you learn how to stop touching your face as much until we get past this virus. And if, like I said, if you are sick, just stay at home, rest. Don't think that the hospital is going to do a whole lot more for you than just staying at home. But if you do get some breathing difficulties, make sure you do talk to your doctor. A lot of clinics are doing telehealth. I know that we are continually improving our telehealth practices. So your primary care may have telehealth services. If they don't, by all means, we're happy to see you. We're happy to manage your care until we can get through this crisis. By all means, call us and we can set up an appointment with one of our physician assistants who can get a hold of your symptoms, track them, keep an eye on you, make sure that things are not progressing to the point where you really do need to go to the hospital. So, what happens to the body after an infection takes place? Well, you're not necessarily going to have to go into this lockdown mode, start hoarding toilet paper. The body does, for the most part, fight this infection. The way it does that is by your immune system identifying what's virus and what's cell-producing virus, and then taking those virus products and those cells-producing viruses out by negating those cells and recreating new cells. And your body is very capable of doing that. Most of us do that on a daily basis. Otherwise, we would all be infected with something. We've done it in the past. Measles is nearly 10 times as infectious as coronavirus, and we got ahead of that. We got that under control. So it is possible for your body to get a hold of this virus. And most of us, that's exactly what's going to happen. And when your body becomes aware of what's virus and what's cell-producing virus, then in the future, everything that we see now based on coronaviruses that have previously existed in our community, the body does maintain its immunity at least for a period of time. A few years from now, we're going to see coronavirus 19, that same strain, out in community, and people will have nothing more than just a mild infection because most of us will have developed some degree of immunity to this new mutation, just as how we have to other strains of coronavirus. So just practice everything that we've been talking about: social distancing to maintain a 6-foot barrier so that aerosolized products have less chance of being attached to you, or that you're less likely to contact each other. I kind of thought this was cute, little masked family. It's okay for you to be social, for you to be out in public. You don't need to stop jogging. You don't need to avoid the outside world and just stay indoors. We haven't gotten to that point yet where the infection really warrants that level of scrutiny. For the time being, as long as you're maintaining your social distances, you're carrying around some way to clean your hands on a regular basis, you're being cognizant of not touching your face, you're in pretty good shape of going out into the world, just being safe and conscious of it. A lot of people ask me, what do you do about groceries? What do you do about takeaway? Well, obviously, you're not going to go out and hug everybody in the grocery store, or kiss the delivery guy on the lips for bringing you dinner. You're going to have packaging to deal with, and you can easily deal with it by just setting it aside for a day or two. You could spray it down with something, but realistically, if you just simply unpackage things, put it in a closed container, discard the packaging, you're not going to be at high risk of getting infected, especially if you wash your hands immediately afterwards. So a lot of people are giving instructions on, spraying everything down. It may be a little bit of overkill. I mean, nothing wrong with doing it, but just bear in mind there's mental energy expended on being super, super duper paranoid about getting infected. And as long as you have some of these safeguards, you can let your mind at ease a little bit. There are reports of the infection of the virus staying alive on surfaces for up to 9 days. Bear in mind that we don't have specific data about this specific strain of virus, but in a laboratory setting, other strains of coronavirus have been known to stay alive and vibrant on products. For the most part, most surfaces are fairly safe to touch after about a couple of days. So for the most part, I wouldn't worry too much about it. But just be aware of surfaces, and as long as you're getting rid of that, then you're probably safe. Everything that we're trying to do right now, everything that we're doing in society, is trying to flatten out the number of people getting infected simultaneously. So if you go to covidactnow.com, they have a map of the entire nation. You can pick out your state and look at what's going on in your state at this moment, how many people are infected, how many people we project would be affected if we have certain scenarios. Like, for instance, if we do nothing at all, we can expect that by around April, late part of April, we're going to start surpassing the number of people getting sick to the number of hospital beds that are available, this dotted line. But if we're reasonably compliant with stay-at-home recommendations, then we're going to elongate that curve and give the healthcare system an opportunity to increase the number of beds available, to increase resources available to treat the infection and prevent that peak from happening at a point we're not prepared. And guess what? If we stay at home with strict compliance, take care of all the recommendations about touching your face, keeping hand hygiene in the forefront of your mind, look at that curve. We're never going to hit the point where we overwhelm the healthcare system. Everything that we're doing right now is not that we're trying to prevent everybody from getting sick. Inevitably, people are going to get sick. What we're trying to do is reduce the number of people who are simultaneously sick, because that means we're going to have fewer people who are simultaneously sick enough to need a ventilator or to be in the ICU. That's the absolute goal, is to try to flatten the curve, meaning flatten the number of people who are simultaneously sick so that the healthcare system can keep up with them. And if we look at past epidemics or pandemics, National Geographic, New York Times both did really good articles about this, where they looked at the Spanish flu, the 1918 flu, and the reaction different cities and different environments had to that flu. If you look at Philadelphia, they were very slow to react, and so they reached a peak of the infection that overwhelmed the healthcare system, and a lot of people did have had a higher death rate. Whereas in other cities, they were able to act quickly, implement social distancing, help people avoid getting infected. And so the number of transmissions slowed down to the point where the healthcare system did keep up. What we just have to be cognizant or mindful of is, after the restrictions are let up, we don't want to go overboard with high-fiving each other and kissing each other and hugging in close proximity, because you can get a second spike, kind of like what happened in San Francisco, where they got the second spike of deaths because it overwhelmed the healthcare system the second time around. So eventually, like I said, we're all going to have an immune response to this infection. We're going to find protection. We're going to develop herd immunity, meaning that critical mass of us will be immune to the infection, where the virus has a harder time spreading from one person to the next because, say, a quarter or half of people are already immune to it. That cuts down the number of people that can be infected or pass on the infection by that number of people. And so eventually it gets to a point where the number of people who are simultaneously affected and passing the infection gets low enough to where the numbers of people who are simultaneously infected get less and less and less, and the infection comes under control. That's going to happen. I promise. It's going to happen. The end of the world is not here. So just have that in mind. Be aware that we've dealt with pandemics in the past. We've dealt with big infections in the past, and we're going to get through this. I wanted to take the last few minutes, answer any questions. I know I covered a lot of ground, but if anybody has any questions, please feel free to type them into Facebook Live. If you catch this video after it's already been aired live, you can ask questions. I promise I'll be paying attention to our Facebook account, making sure to answer questions. But if anybody has any right now, please by all means ask. I just wanted to end on, let's go backwards. I wanted to end on kind of an optimistic note. Like I said, every time in history we have taken a long road, we've taken a hard road, we've seen some challenges. It can be terrifying moving into those challenges. It can be really scary dealing with the unknown, the things that we're afraid of, the things that we fear, the safety and security of our loved ones. These are times that we can approach in one of two ways: either be terrified and look at it as this ominous event in our lifetime, or we can look at it as a long road in which we know a destination is in sight. We just know that it's going to be a difficult process, and look at it as a challenge that can help us evolve, that can help us grow, that can help us get stronger. Particularly our healthcare system. We had a team meeting today with my staff, and I've got to give kudos to my staff. They've been amazing in their responses, and we have very rapidly evolved our systems to help accommodate this infection, and we're actually finding some valuable resources that we didn't know existed before that we're going to probably implement even after the infection is done. We are seeing this. We're taking the approach that this is a challenge for us to overcome, and we as a community can do that. So I'm getting a couple of questions. If you have the virus on your hand and you eat something, can you get sick with the virus? The oral transmission rate is lower. Doesn't mean that it can't happen. It's just lower. So I do recommend before you eat, before you bring your hands close to your face, which is a process that happens in eating, wash your hands. It'll just help rid your hands of all the virus that contaminated throughout the day. Wash make sure you're pulling out dishes that are clean. Hopefully you're doing that on a regular basis. But just make sure that the environment in which you're eating has the lowest probability of having any viral infection. John Santfani asks, do you think it's fine to hang out with friends at a park as long as you keep your distance? I do. And this is really important because we are social creatures. We need connection with people. FaceTime, Google Hangouts, Zoom, these are all fantastic ways of communicating. But at the end of the day, we need that human connection. And before you go out and start giving people hugs, I think it's fine to go out into the community, have a face mask on so that you're aware to not touch your face. Be at a 6-foot radius of each other so you have less probability of accidentally spitting on each other and spreading the virus. Bear in mind that people can be contagious even when they're not showing symptoms. You can be contagious a couple of days before your symptoms. Some people are never symptomatic at all. But just be aware that it can happen. It doesn't mean you have to be paranoid about it. It doesn't mean you have to avoid all contact. It's just you want to change the way you do things. And it's really hard to do that on a large scale, on a societal scale, without taking some drastic steps. So it's okay to meet with each other. I saw, I took a picture of this and I'll try to post it later, but across the pond in my in a neighborhood, I was looking at some people having a get together, and they were all sitting in a circle at a pretty wide distance from each other, but they were socializing, and we need that. That's valuable. I think you should be doing that. Just make sure that you're being mindful of the distance. You're not going to play soccer. You're not going to play basketball with your friends. You're just maintaining distance and trying to maintain a social connection with each other, because we're going to get through this, and we're going to get through it even better together, where forced social distancing is going to make us more connected and give us that realization of how valuable we are to each other. So I think I've talked enough. I meant to keep it under 30 minutes, but by all means, please share this video. My hope is that we can reduce the anxiety around this, empower people to feel like they can take ownership of their health, they can keep their loved ones in safeguard their loved ones, and they can still live a social life while finding creative and innovative ways of maintaining the economy. All of that is possible. We as a human society have done amazing things in the past. This is just another one of them, and we will go down in history as having overcome something tremendously arduous, but having thrived in such conditions. Thank you, everybody. Stay strong. Pass the message, and if you have any questions, feel free to reach out. Thanks for your attention.